words, if I'm understanding you correctly, the immunomodulators, after decades of experience, they don't have any particular side effects, say like other kinds of chemotherapy or things like that. So if they're controlling the MS for a person, we're not seeing bad long-term side effects from that.
Right. I'm going to use terms like modulate. What does that mean? So most people don't know what modulation is.
Right.
Remember the three functions of the immune system, right? Protect from invasion without and within, and repair. It's also clear that the immune system is doing something wrong in chewing up the myelin and causing MS. So how do we deal with that aspect, but leave the other intact? Because you still want a functioning immune system. We call this an immunocompetent system, something that will work, but not attack the central nervous system. It's a balance. So that's where the modulators have come in, because for the most part, they have reduced the attack on the central nervous system and spared the ability of the immune system to still do these other things, right? In some patients, their disease exceeds the ability of these modulators to do it. So you have to pull out stronger therapies.
Right.
The therapies are stronger, but they're going to compromise.
Before we go to that for a second, so what I'm hearing is that there's one basic piece which is helping the person be healthier, another piece which is dealing with... And feel better. And then dealing with the complications, whether it be cognitive or sensory or motor, and helping them function better. And then you're talking about the immunomodulators, which affect the natural course. So I'm not sure we've defined that so well for our audience, because MS, as many people understand, kind of comes and goes. So
well, that's actually, they appreciate... That's not. You speak to the average MS patient, they're going to tell you it never goes.
Okay.
Those symptoms are there every day.
Right.
What we're talking about coming and going are the exacerbations, where there's a tendency for it to get much worse and then tend to improve, at least in one form of the illness.
And now when you say getting much worse and improving, you're talking about the inflammation and damage? You're talking about the symptoms, or both?
No. The focal damage that occurs that escalates at times for whatever reason and leads to what we call attacks, where patients can get from not seeing to seeing to not seeing again, to seeing double and then improving, to not walking and improving. The symptoms can be quite acute over days and quite disabling, and then they improve again. So those are the attacks, and that's what we're trying to cut down on, because that's big pockets of inflammation that have affected certain parts of the brain.
So now, in light of that explanation, changing the course of disease with immunomodulators, what does that mean exactly?
Well, those types of attacks are either reduced substantially in number, but also severity. So instead of having total paralysis below the legs, you might have a little weakness of a foot for a few days. Easier to recover from than total paralysis, right? So the immunomodulators they reduce the attacks, they reduce the inflammation. We've seen that from MRI studies. And all of that is expected to translate into less accumulated damage. And it's the accumulated damage which, when it exceeds a certain threshold, which will be different in every individual, trips the patient into now a more progressive course, which is really a reflection of the accumulated damage over many years plus aging.